I just got this in the mail from the Fear Free people. Let's see what it is.
Yeah.
It's a new treat bag.
Oh, wonderful.
And I got a couple of badges in here. Fear Free Level 2. So this Fear Free program's been really good for us. This is the second year that we've been doing it. So every year I do an 8-hour course, and now I've completed Level 2. And I need a new treat bag because I keep one with me all the time. And some of the things you might notice that we do different around here is based on this Fear Free program. And the point of it is our goal is to be completely fear-free so pets are not afraid of the vet.
Yes.
It's hard to reach that goal, but we're making steps in that process. So we talk about fear, anxiety, and stress in pets.
Yes.
And we try to reduce that. So our ultimate goal will be completely fear-free, but if we can just reduce that stress, then we can make the visit more enjoyable.
Yes. So what are some ways that we do this in our practice?
Well, one thing I do is I keep my treats with me all the time. So even if I don't have a treat in my hand, which a lot of times you might see, I come in the room and I'll throw the dog a treat and I'll say hi to him. Sometimes he'll come up and they'll just touch their nose to me and check me out, and then I'll just ignore them and I'll go and walk away and sit down. And because they're investigating me and trying to get to know me, and if I come towards them and try to grab them, then they feel threatened. So I try to, really what we're trying to do is communicate in dog language to them. So we say, it's okay, baby, sit, stay. Those are all human things that we do. But when dogs greet each other, they sniff each other and they check around, and then they watch each other, and they go around the room, and then they finally decide they're going to play.
Yeah.
So that's one thing is the introduction. I think you never get a second chance to make a first impression. So that's the same thing with pets.
Yes.
So you've done the Fear Free program as well.
Yes, I have.
What have you learned from it?
I learned to identify warning signs. So when a dog or cat is experiencing fear, stress, or anxiety, some of the things we look for, like hair standing up on their back, we look at their pupils, see if they're dilated or not. We'll look at signs of their posture. So if they have their tail tucked or their backs arched, those can be big warning signs that they're feeling uncomfortable in their environment. So
yeah, some of the things, even if it's your own pet, you may not notice in the vet, but we'll notice it, is that the thing with their eyes are dilated, their ears are just slightly back, and they're just some of those body postures can really tip us off to they're having a tough time. And in our exam rooms, we kind of have a routine there, and the dogs have a routine. There's a certain corner they like to hide in. There's certain places that they go to, and we say, oh yeah, he's a little bit stressed because he's going to the hiding corner, you know? Yeah. So, how about kitty cats? Cats are different, aren't they?
yes, cats are different. So cats will also try to hide sometimes. They'll try to find their escape route. They will also show posture signs. So if they have, a tense up posture, we can tell a lot of the times with them.
So if you have a pet that is stressed or fearful or anxious about going to the vet, give us a call, because there's some things you can do at home before you even come here. And in some cases, they need medications to come to the vet. I know it's a big thing in human medicine. You talk about people who are afraid to go to the dentist, and they take a little medication before they go to the dentist to help them relax. That's the kind of thing we do with pets sometimes too, because if they have a good experience, even if it's under medication, then the next visit after that is going to be even better, and we can work to make their vet visits better. And it also helps with the socialization, if they can go places and meet other people better too. So check in with us about that.
So it's very common.
There's the... What is it? He gets... Oh, you're saying it. You're saying it. Oh, hello. You are... Oh, Boozy. It just smells bad. You can't eat it.